Sadly, not everyone who gets depressed gets better with medication treatment. We call this treatment resistance. It's a frustrating situation to deal with, but there are things that can make you treatment resistant that are changeable. That's what I'm talking about today. I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. There was a landmark study from 2006 called the STAR-D trial, which stands for Sequenced Treatment Alternatives to Relieve Depression. I won't go into details of the study because there's lots that came out of it, but suffice it to say that it was a huge trial with lots of people enrolled and was designed to see how well our antidepressant treatments work. The study included 4 treatment stages that included medication switches and add-on agents. If the first one didn't work, you moved on to a different medication or got something added to your medication. And that's pretty much how we do things in practice. If one doesn't work at all, we switch to another. If it partially works, we may add something to boost the effectiveness. This is called augmenting the medication. The study found that only 1/3 of people achieved remission from the first antidepressant, remission being a resolution of your symptoms. It took 6 weeks to see some response and then 7 weeks to achieve remission. Of the people who went through all 4 steps, only 67% of those people achieved remission. So what does this mean practically? There's a lot of people who fall into the treatment-resistant category. In practice, treatment resistance is defined as failing to adequately respond to 2 trials of an antidepressant. It's important to understand that treatment resistance is not the same as medication intolerance. You can stop a medication after a few days because of side effects. And if that happens, the trial of that medication doesn't count as a medication failure when it comes to looking at treatment resistance. Because of side effects, you weren't able to see if the medication would have helped your depression symptoms. Another caveat here is before you consider the medication a failure, you have to give it enough time. In this study, it took up to 7 weeks for people's depression to resolve. Why does it take so long? 2 factors. One is therapeutic response requires you to take a dose that's in a range that's high enough to work. This is called the therapeutic range. Oftentimes, your doctor will start you at a low dose and gradually work you up to the therapeutic range. The second factor is, once you've reached the therapeutic range, your brain receptors and circuitry need time to respond and adjust. Then the emotional improvement follows. Let's say you have tried and failed to respond to 2 or even 3 different medication strategies, or you have some improvement, but it's not enough and you're still pretty depressed. We call this a partial response. Here are some physical conditions that can, in their own right, cause depression symptoms, making it hard for your depression to resolve from antidepressants alone. Hormone imbalances like hypothyroidism, low testosterone, and low estrogen. In all of these cases, hormone supplementation can improve your mood symptoms. In fact, sometimes we will use thyroid supplementation as an augmenting strategy to treat depression, even in someone who has normal thyroid levels. Chronic pain syndromes can cause depression in people who don't have a history of being depressed. So if you're already depressed and have chronic pain that's inadequately treated, that daily pain experience can negatively impact your response to antidepressants. There's a very strong link between fibromyalgia and depression, such that many people have both. It's no coincidence that the antidepressant duloxetine, brand name Cymbalta, is prescribed to treat both conditions. If you have ever had a stroke or heart attack, you're at greater risk of developing depression. A stroke can result in personality changes that can mimic depression, so it can seem like you're not bouncing back to your old self because you're more irritable and emotionally labile. Sometimes adding a mood stabilizer can help your symptoms more than the antidepressant alone. So in all of these cases, looking past psychological causes may give you the answer as to why you're not getting better. Then the next thing to look at is your entire medication regimen. What medications are you taking for other conditions? Some medications have depression as a side effect. Taking an antidepressant doesn't necessarily offset that effect. A 2018 study showed a multiplier effect if you take more than one medication that has depression as a side effect. So the more you take, the greater the risk of becoming depressed or having your depression be harder to treat with antidepressants. Here are some of the medications that can cause depression as a side effect. It's a fairly long list, and I'll have a handout for you that you can download from my website. Here are a few of them. Acid reflux medications. Examples are omeprazole, ranitidine, and famotidine. Allergy medications like montelukast, which is Singulair, or cetirizine, which is Zyrtec. Anxiety medications, mostly the benzodiazepines like alprazolam, diazepam, and lorazepam. Even zolpidem for sleep has this potential. Birth control and hormone therapy containing estrogen. Some blood pressure medications like atenolol, metoprolol, and enalapril. Pain medications like ibuprofen, cyclobenzaprine, hydrocodone, and tramadol. And then there's anti-seizure medications like gabapentin, topiramate, and lamotrigine. Now, you may have been on one or some of these medications for years. It's not a guarantee that you will experience depression as a side effect if you take any of these. All medications have a long list of potential side effects, and some people get several of the effects and some people experience none. So I don't want you to think that you can't take any of these medications. The learning point here is that these medications carry a risk of causing depression, and the more you take, the greater the risk. And if you have depression that is not improving enough with your current antidepressant treatment regimen, one thing you and your doctor can do is take a look at whatever else you're taking and see if you can take alternative medications that don't carry the risk of causing depression. A couple of these medications I mentioned are over the counter, like ibuprofen and Zyrtec. If you want to consider some non-prescription medication options for depression, take a look at this video. And this other one about ketamine is one of the premium solutions for treatment-resistant depression. Thanks for watching. See you next time.